Dementia Researcher with a blog and a rating.
Relational counselling as a psychosocial intervention for dementia. Receiving a diagnosis of dementia is life-changing in many ways for the person and their family and friends. Learning to live with the diagnosis can be challenging, upsetting and complex. In addition to this, people with dementia and their family members are prone to experiencing depression and anxiety as they adjust to the changes brought by the condition. There is a clear need for emotional and practical post-diagnostic support, and counselling offers one way to deliver this. Counselling is a talking therapy involving regular sessions between a therapist and a client to discuss and make sense of experiences, find ways of coping, and where possible, resolve specific issues. For people affected by dementia, this may focus on working through feelings of loss and social isolation, role change from partner to carer, and coping with deteriorating health. The therapist role is to support clients through listening, showing empathy and warmth, and engaging in discussion. Our recent systematic review identified mixed evidence for the benefit of counselling for people with dementia and/or their family members on a range of outcomes including depression and quality of life. However, very little research considered the thoughts, feelings or experiences of the people who actually received the interventions. We sought to fill this gap in understanding by exploring experiences of an individual counselling intervention for people affected by dementia using their first-hand perspectives. We wanted to give participants the opportunity to explain what counselling meant to them, rather than looking at changes in predetermined outcomes. We interviewed 6 people with dementia and 23 people who cared for a relative with dementia before and after a 12-week counselling intervention. Our results found 4 main areas of importance for participants. Firstly, the expectations and outcomes of counselling. There was a sense of urgency in seeking counselling whereby participants expected improvements in their mental health and quality of life as a result of the intervention. Participants were often focused on acceptance of the diagnosis as a key outcome. The burden of dementia was considered in the context of the emotional impact of life with dementia. They worried about being a burden to others, the burden of coping with dementia, and the additional life pressures aside from having caring responsibilities for family members. People noticed changes in their own personality and behaviours and benefited from being able to talk through these. Participants reflected on appraisals of their identity as counselling encouraged them to reflect on who they were. This helped to improve understanding of how to build resilience and focus on self-care, including the importance of having a strong support network. Finally, participants highlighted the importance of the therapeutic relationship and gratitude for working with a therapist with an existing understanding of dementia. They also appreciated having someone who was an impartial listener and allowed them to feel comfortable to talk openly about themselves and their family. Overall, our research suggests that counselling may provide vital support and lead to positive experiences for people affected by dementia. Such benefits may not be easy to quantify through standardised measures, emphasising the need for research which includes the first-hand experiences of those involved. There is clearly a huge emotional impact associated with the diagnosis of dementia, yet very little support is currently available for those affected. This is a specific area where counselling could help individuals and their families. Something that this research highlighted to us is that currently there is no dementia-specific content taught within counselling training programmes. As the number of people living with or supporting someone with dementia continues to increase, we would expect to see more people seeking counselling to help them come to terms with their situation. In-depth training and guidance is needed for therapists to ensure that they are able to provide appropriate support to clients whose lives are affected by dementia. This is particularly important as people with dementia have been labelled as beyond therapeutic reach, meaning that they would not be offered counselling-based interventions. We challenge this presumption as our research has demonstrated that people with dementia can meaningfully participate in counselling interventions and build a therapeutic relationship with their therapist. However, we do acknowledge the challenges that memory loss presents for counselling. Therapists with the expertise to gain in-depth understanding of each individual, their specific needs and the way they communicate will allow people with dementia to still benefit from counselling. In summary, our research explored how people with dementia and their family members experienced counselling interventions in their own words. We hope to use this knowledge to develop further research exploring current opportunities for counselling that are offered to people with dementia via the NHS across the UK.
Thank you for listening. Join the Dementia Research bloggers and share your own views.